Vincere Biosciences is developing USP30 inhibitors that have potential for Parkinson's disease and other age-related indications. Traditional medicine has a problem whereby diseases are treated separately, but we all know that aging is the biggest risk factor for most diseases. Mitochondrial dysfunction is a particularly compelling hallmark of aging that contributes to Parkinson's disease, heart failure, and kidney disease. When mitochondria are damaged and dysfunctional, they can cause a cascade of problems, including inflammation and immune activation, that can contribute to aging and cell death. Our USP30 inhibitors enhance the natural process of mitophagy that bundles up damaged mitochondria and returns the cells back to a healthy state. We have a pipeline of molecules that are nearing clinical trials led by brain-penetrant, orally bioavailable selective inhibitors for Parkinson's disease, some topically optimized molecules that were recently partnered with Beiersdorf for anti-aging skincare, and peripherally restricted molecules that have potential for cardiorenal indications. Parkinson's disease is particularly compelling because mutations in this pathway cause early onset familial forms of Parkinson's. Recently, animal data has backed up this approach, showing that if you knock out USP30, you can prevent neurodegeneration and reduce the alpha-synuclein accumulation in the animal model of Parkinson's. Our molecules have been shown to very robustly increase the mitophagy process in the brains of mice, and excitingly, they do so more robustly in aged mice, where we know that mice have a deficiency in this process, a deficiency which is also shared with aging humans. The molecules have also shown protection in multiple forms of acute kidney injury, actually being able to restore kidney function when delivered after the injury has already occurred. We think this opens up a large set of additional commercial opportunities, but also I think is exciting from a geroprotective perspective, where this shared mechanism of aging shows protection across multiple therapeutic areas. Our company is founder-led and backed by some great world-class advisors, and we've been able to recruit a phenomenal team of drug developers who have taken drugs not only to the clinic, but all the way through to market approval and understand what it takes to be successful in this space. 2025 has been a very exciting year, starting with a out-licensing for anti-aging skincare to Beiersdorf, one of the top skincare companies in the world, as well as a financing that gave us the capital to move our lead molecule for Parkinson's through IND enabling and CMC to get ready for clinical trials. And then finally, a recent grant of $5 million from the Michael J. Fox Foundation that gives us some great scientific validation, but also additional capital to de-risk the program. The coming year has very clear objectives. We're going to wrap up the GLP tox studies and prepare for clinic entry and have a solid phase 1 plan to demonstrate safety, pharmacokinetics, and target engagement, including testing in some Parkinson's patients. Now, this IND stage, phase 1, is very common point of partnering for CNS assets, typically at a pre-IND or post-phase 1. And we have some great conversations undergoing with pharmas who are very keen to develop in this space. We're hopeful that we'll be able to get a transaction done over this timeline that will bring the right partner on to conduct the longer Parkinson's disease trials. And to strengthen position in that conversation, we are looking to raise some additional capital now that would give us the ability to run the phase 1 ourselves and starting conversations with potential lead investors. And we anticipate that this will just be 1 or 2 new investors joining our cohort to get this through the next stage. With that, we'd be happy to chat if this aligns with your strategy.